Hi, I'm Dr. Shannon. I'm an Ontario-based naturopathic doctor with a clinical focus in hormones, fertility, and pregnancy. And today I wanted to chat with you about the menstrual cycle. So this is something that a lot of us as young kids were taught about maybe in health class when we were, 12 or 13 years old. And if you're like me, you're probably pretty uncomfortable with the fact that you're sitting in a classroom of your peers with an adult talking to you about bleeding and periods and making babies. So that information might have gone in one ear and then out the other. So if that's the case for you, I totally don't blame you for not fully understanding what the menstrual cycle is all about. So this video and this information will be really pertinent and helpful for you, hopefully, if you are just someone who gets their period or gets a period on a month-to-month basis and wants to learn more about what that process is all about. I think this will also be really useful for anyone who's hoping to get pregnant at some point in the future, or maybe who is already trying to get pregnant and is kind of feeling a bit confused about what's going on with their body. So like all good things in life, it probably makes sense to start at the beginning. So our first day of our menstrual cycle, or I guess I should backtrack by saying we often talk about the menstrual cycle in terms of its length and how many days the cycle lasts. So a menstrual cycle starts on day one. Sometimes that's called cycle day one, or in the whole kind of fertility world, sometimes it'll be abbreviated or shortened as CD1. So if you read that somewhere, that's what that's referring to. So day one, or cycle day one. And this is the first day of full menstrual bleeding. And why I am kind of specific to say full menstrual bleeding is that some people experience some spotting before their period starts. And this is a big point of confusion for a lot of my patients, is like, when do I start counting at day one? And so that spotting is actually considered the end of your last menstrual cycle and not the beginning of this new menstrual cycle. So cycle day one, first day of full bleeding. Typically people will have bleeding, and I use air quotes a lot to say what is normal. I would say a normal cycle or bleeding lasts for about 3 to 5 days. Certainly some people will have bleeding that's a little bit shorter than that or a little bit longer than that, and that might also be considered normal. But I would say average and what we consider to maybe be optimal is 3 to 5 days. If you're bleeding for more than 5 days and it's quite heavy and significant, again, that could mean that there might be some hormonal imbalance. Or I also start to get concerned or worried about things like your iron levels or whether or not you're going to develop anemia, because heavy bleeding can contribute to that long term. On the other end of that spectrum, if you're not bleeding for a full 3 days, or you're having very light bleeding for only 1 or 2 days, that might be nice from a quality of life standpoint. But if you are thinking about trying to get pregnant, it might indicate that your lining isn't growing quite thick enough to support a pregnancy. So again, that might be of a concern on one end, whereas really heavy bleeding might be concerning on the other end. So 3 to 5 days is what's considered optimal, healthy, normal, lots of air quotes. And this marks the beginning of a phase of our cycle called our follicular phase. So our cycle has 2 phases, the follicular phase being the first, and the follicular phase ends around the time of ovulation. I'm gonna launch a whole extra video later on about ovulation and understanding when in your cycle you're ovulating. It's a pretty significant event in the cycle and a little bit more than I wanna get into today. But understand that the follicular phase starts with menstruation or our period, the bleeding part, and it ends at the time of ovulation. And this follicular phase of our cycle is kind of dominated by the hormone estrogen. So estrogen will rise during the follicular phase, helps to mature what's called our follicle in our ovary, hence the name follicular phase, that ultimately will grow and mature and release an egg at the time of ovulation. The second half of our menstrual cycle is called the luteal phase, and this is going to be from ovulation until you get your next period, or if you don't get your period and you have a positive pregnancy test. The luteal phase, unlike the follicular phase, tends to be pretty fixed in duration. So for most people, it's about 14 days or 2 weeks long. So we can usually determine if we know when you've ovulated, we can usually determine that about 14 days later, we're either expecting you to get your period, or if you miss your period, that's a time where a home pregnancy test would be positive. Like I said, the luteal phase tends to be pretty fixed in duration on a cycle to cycle basis, whereas the follicular phase can change. So some people can have a shorter follicular phase 1 month and a longer follicular phase the next month. And that's the part that, let's say 1 month your cycle is about 27 days, the next month it's 29 days. More than likely it's the follicular phase that was 2 days longer, or it took you 2 extra days before ovulation occurred. I hope that makes sense. The luteal phase is dominated by the hormone progesterone. So after we ovulate, our body will secrete a hormone called progesterone. You can also think of this as our progestation hormone. And that's the hormone that, if we were to be pregnant, sort of helps sustain a pregnancy. So progesterone peaks about a week after we ovulate. And if we're not pregnant, if nothing's buried in or implanted into the lining of our uterus, then progesterone will start to decline. And that's what ultimately contributes to the shedding of that lining or our period starting with the next cycle. That's where I wanted to come back to that spotting before your period, is that some people will start to spot for a few days before their full period starts. There's a couple of reasons why this might be happening, but one could be that progesterone hasn't reached a high enough peak in that luteal phase of your cycle. And as a result, that lining starts to shed a little bit sooner. So again, if you're not trying to get pregnant, other than this being a little bit annoying, it might not be a massive issue or concern. But if you are trying to get pregnant, this can be problematic, because if an embryo is trying to implant into the uterus at the same time that the lining is starting to shed, that's not ideal, right? And that might result in you not actually becoming pregnant. So as a quick review, cycle day 1, first day of our period. Then we're going to have our follicular phase, which can vary in length. I would say on average, I see it anywhere from about 10 days to maybe, I struggled a bit with my math here. I wanted to say 10 to 20 days. Whereas the the luteal phase is going to be fixed at 14 days from the time of ovulation until the time of our next period. So if we add those things together, we'll see that an average cycle length might be anywhere from about 24 days to maybe 34 days. And kind of anything in that whole range is considered healthy and normal. But what I will say is that we want to see that things are regular from month to month or cycle to cycle. So if 1 month your cycle is 21 days and the next month it's 35 days and then it's 28 days and then it's 40 days, that's considered irregular, and that's not optimal and not ideal. And in fact, that might actually indicate that there's some other processes going on, hormonal disorders as an example, which might be affecting that ovulation time or that follicular phase, causing really dramatic changes cycle to cycle. But if we see that 1 month our cycle is 27 days, the next month it's 29 days, then it's 28 days, that's definitely considered regular in the sense that it's pretty consistent cycle to cycle or month to month. And being, kind of plus or minus 2 or 3 days on either end is totally normal. So yeah, that's kind of what the cycle looks like in terms of how to count it and how to understand what's happening when, and maybe how long you might expect your cycle to be. Like I said, I'm going to do another video talking more specifically about ovulation and understanding when in your cycle you might be ovulating. There's some signs and clues our body gives us and some tests that you can do at home that will make that process a lot clearer. And that's a really critical piece to understand when you are trying to get pregnant. So that'll come in another video. If after watching this, you're thinking to yourself like, oh, I have some concerns. My cycle doesn't look like what she's describing. It's really long, or it's really irregular, or my bleeding's really short, or my bleeding's really long, and that's prompting some concern for you, I'd love if you reached out to me. So send me a DM or shoot me a message on whatever platform you're watching this. Alternatively, you can head to my website, www.shannonnd.ca. Click the Book Now button at the top right corner. That'll link you to where you could book a complimentary or a free 15-minute meet and greet appointment. We can have a quick phone chat or video chat to talk through your cycle, understand what's been going on for you, and understand if working with a naturopathic doctor is the right next step for you in terms of sorting out your hormonal health. Thank you so much for spending your time watching this. I hope you learned a lot, and I'm really excited to bring you another video in the future about ovulation. Okay, take care.